Hello everyone, Namaskar. Do you know what to do if someone takes too many pills than prescribed in the fits of rage, or elderly people who forget and take many doses of the same tablet? Well, I'm Dr. Sanjay Misra, consultant medicine from Delhi. So let's see what to do instead of panicking. Uh, so poisoning, if we see, it is not only of taking tablets, but it can happen due to inhalation or touching or injecting various drugs of venoms, chemicals, and even gas. We heard about the Bhopal gas tragedy. So it was gas that caused the poisoning. The first reflex that people do is people force others to do is induce vomiting. Now there is no good evidence which proves the effectiveness, and it is often harmful than doing good to the victim. What are the harms? In which cases the harm, it can be more harmful is like a person has taken kerosene, a person has taken acids or phenyl. So in these cases, inducing vomiting will do more harm than the benefit. And even if the patient reaches the hospital, gastric lavage is not done in these cases. So what are the first aid that we can do till either help arrives or till we take the patient or victim to the hospital? So in swallowed poison, we have to remove anything remaining in the person's mouth. In case of poison on the skin, it should be removed with gloves and rinse the skin for 15 to 20 minutes so that to remove any unabsorbed toxins from the skin. If there is poison in the eye, gently flush the eye with cool or lukewarm water for 20 minutes or until help arrives. In case of inhaled, the only way out is to take the person in a fresh air as soon as possible. So in swallowed poison or drug overdose, what can be done? Like I said earlier, to remove anything remaining in the person's mouth. And then we can give activated charcoal. This is a thing which is harmless. It can be given 5 to 10 tablets to chew. And we should try our best to rush to a nearby hospital. Any small hospital has the capacity to give a gastric lavage, and the doctor on duty can take help of the National Poison Center. So one question would arrive, should we keep this activated charcoal for this purpose? No, activated charcoal are also used in many purposes, like for bloating, for abdominal pain. It is also used for whitening of the teeth. It is used for glowing of the skin. The activated charcoal is also can be bought in the form of powder, or this tablet can be formed in the form of powder and applied on the skin. So it has a multiple use, and it can be kept in our first aid kit. So what does activated charcoal do? Studies show that if we make the person ingest 50 to 100 gram of activated charcoal within 5 minutes of taking the drug, it will reduce the ability to absorb the drug up to 74%. So that's really great to achieve such percentage of toxins wash out after ingestion, because the more the drug is absorbed, the more harmful it will cause to the body. In some cases, activated charcoal is not advised, or it doesn't work, like cyanide, lithium. Lithium is basically used in antidepressants, alcohol, iron tablets. Well, if in doubt, better to give If it won't act, it's okay, but we should try to give activated charcoal. There may be cases where unknowingly or knowingly paracetamol or sleeping pills overdose has happened. So what can be done? Well, give activated charcoal, as I said, rush to any nearby hospital. If taken to hospital within 30 minutes, well, what they do is uh, gastric lavage is being done and all unabsorbed material is being washed away. Please note that paracetamol poisoning does not give immediate symptoms. Like if sleeping pills, it will give immediate symptom. People will feel drowsy. But in paracetamol poisoning, it won't show any poison. But still, this activity has to be done as soon as possible, because after 2 to 3 days, the paracetamol acts on the liver and there is a liver failure, and that is really harmful. So toxic doses of paracetamol is 3 gram in 24 hours. So in case of fever, we should try to keep our doses less than 3 gram. Now we have heard of antidotes, and normally antidote come for snake bites or very few things, but many drugs has an antidote, and if it is delivered in time, the patient's life or the patient's disease period can be reduced. So time is very critical, because the drug which is being taken will be absorbed in a fast rate, and the faster we act, the more effect it will be done. So some of the examples of antidotes are like for paracetamol, there are acetylcysteine. Acetylcysteine are also used in cough syrups also, but they do act as an antidote of paracetamol. For methanol poisoning, basically alcohol which is brewed at home or contaminated alcohol. So ethanol is the antidote for that. Similarly, there are many antidotes for many drugs which are dangerous. So victims can be helped if the victims are rushed to the nearby hospital and gastric lavage is being done where indicated. Many people may not be knowing, but there is a National Poison Information Center. It is situated in AIIMS, and this is the toll-free number. It is a 24-hour service. So if any doubt, any hospital person or any person can call directly and inquire what to do in case of a poison has been accidentally or knowingly has been taken by someone in the family. So this would be about poisoning. Regarding different antidotes and what to do in drug overdose, I think I should make another video where there will be clarity in which drug what to do next. So that would be all for today. Thank you.